Millions of Americans had the opportunity to make changes to their Medicare coverage last fall, but being proactive about Medicare coverage doesn't end once the annual enrollment period's over. Joining us now to discuss how people should mostly take effectively using their Medicare plan to support their overall well-being is Chief Medical Officer at UnitedHealthcare and Medicare Retirement, Dr. Philip Painter. That's a lot there, Doctor. How are you?
I'm good. How are you?
You know, I'm in good spirits because I've started to, take advantage of some of the things we're going to talk about, because it's not just about us, of course, getting our Medicare plan taken care of. It's about being proactive. So let's talk about some of the things about that.
Well, it's a new year, and a lot of people have a new health plan with new coverage and new benefits that they're trying to understand. So really encourage people to dive in, understand what their coverage is, understand what those benefits are. And a great place to start with that is think about what preventive or screening things you may need during the course of this year. Get those things planned. Medicare health plans have great coverage around preventive and screening things such as cancer types of screening. So get those things planned out. And then if you have a Medicare Advantage plan this year, take a look at what I call extra benefits that may be covered. So things like vision, dental, hearing services. And for example, at UnitedHealthcare, we have a program called Renew Active, where we have fitness club memberships for our members, and they can use that to stay healthy throughout the course of the year and develop their fitness plan. In addition, we have something called house calls, where we send a nurse practitioner into our members' homes to do a comprehensive health assessment, get your health plan set up for the year, and understand what's best for you in terms of your health and your coverage. So all good ways to take advantage of your new health plan and some of those benefits.
Yeah, I love the part about the fitness one, because I've been telling a lot of people and they didn't realize that, going, wait, I can have a membership to a gym? Yes, you just got to look at your plan, which is so important. And what's very important, of course, is that some people are on fixed incomes, retirement dollars are pretty much being spread across. So what's some tips you have for us to look at saving money on our Medicare?
Great point. Really important that you have kind of a healthcare finance plan through the year. And so when you look at your current benefits in your plan, understand what your coverage is, what your out-of-pocket costs might be for certain services like doctor visits, tests, even going to the hospital. And you can make a financial plan around your healthcare for the year. And a great place to save some money is around prescription drugs in terms of cost. And some simple things to do there. One is if you're able to have home delivery of certain medicines, take advantage of that. You can get 90 to 100 days supply of medicines delivered to the convenience of your home with much lower cost. And then have a conversation with your doctor about generic medicines. Understand if there's some generic options that might be right for you, given your current health and the coverage that you have. And then lastly, if you go to a local pharmacy, make sure that pharmacy is in your plan's network, just like you look at the hospitals and doctors that you see to make sure that's in the plan network. Also important that you understand if your local pharmacy is in the network, that can save you money as well. So I think just prescription drugs, great place to start and get some savings for yourself with your new health plan through the course of the year.
Yeah, Doctor, gosh, I'd love to go on and on about this because it's so important, especially right now for a lot of people. But where can people go right now to find out more information about saving money and, of course, learning more about their Medicare plans?
Well, if they have a UnitedHealthcare Medicare Advantage plan, they can go to uhcmedicarehealthplans.com, or take a look on the back of your new ID card, and there should be a phone number there. Give your health plan a call, talk with someone about your coverage, and understand how you can make that coverage work best for you in the new year.
Perfect. Doctor, thanks for joining us this morning.
Welcome.